Welcome back. Today we're diving into something huge: mental health. It affects, well, nearly a billion people globally, according to the WHO back in 2019.
That's an incredible number.
It really is.
Wow.
And here in the US, it's something like 22.8% of adults dealing with mental illness. Now think about adding autism into that mix. Recognizing symptoms gets really complicated.
Yeah, the overlap in symptoms can be a real challenge.
Exactly. Plus, relying on patient recall,
Yeah,
it makes early diagnosis tough.
definitely. It's a known difficulty.
Which brings us to today's deep dive. We're looking at a study, a really interesting one from the Alexandria Engineering Journal.
Okay.
It's called Explainable Artificial Intelligence Systems for Predicting Mental Health Problems in Autistics.
Explainable AI, right. That's key.
Yes. And our mission really is to unpack how this AI might offer a shortcut, to getting earlier, more accurate diagnoses for autistic individuals.
And crucially, understanding how the AI is making those calls, not just the what, but the why.
Precisely. So let's dig in. The core innovation here is this thing called the Explainable Mental Health Disorders Model, or EMHD.
CMHD, got it.
And it sounds impressive. It uses machine learning, but also this explainable AI, or XAI.
Right.
The goal is spotting mental health issues really early, even in toddlers, which feels like a big step.
It really is. And that explainable part you mentioned, that's probably the most fascinating aspect too.
Tell us more about that. Why is explainable so important?
Well, traditionally, AI can be a bit of a black box, right? It gives an output, maybe a prediction, but doesn't show its work.
Right, you just have to trust it.
Exactly. But EMHD uses XAI, specifically a method called SAP. Think of it as shining a light inside the box.
Yeah.
SHAP basically shows which specific symptoms or data points push the model towards a particular prediction.
So if it flags anxiety, SHAP might say breathing rapidly was a big factor for this specific case.
Precisely that. It provides transparency. You see the reasoning. It helps build trust in the tool.
That transparency sounds critical. And the performance they reported, it's kind of stunning.
What did they find?
They achieved 1.0 across the board, accuracy, precision, recall, F1 score.
Wow, 1.0. That's perfect, essentially, on their test data.
Yeah, nearly perfect identification in that context. 0 false positives, 0 false negatives. It blew other models like KNN and LSTM out of the water in their comparison.
That level of performance, even on a specific data set, is remarkable. It shows the potential power here.
So what did the model actually learn? What drove those perfect scores?
Good question. So the EMHD model was trained using a Kaggle dataset. It had data on 12 different mental illnesses from 637 individuals.
Okay.
And it consistently flagged certain symptoms as highly influential, things like breathing rapidly, hopelessness, and trouble in concentration.
Interesting.
Yeah, those kept popping up as strong indicators. The data also showed different typical ages of onset for various disorders.
Right.
And interestingly, across the whole data set, feeling nervous and breathing rapidly were the most common symptoms reported.
So bringing this back to the listener, what's the real-world implication? Why should you care about this EMHD model?
Well, the potential is enormous.
It seems like it could mean much earlier intervention, getting the right support sooner.
Exactly. And crafting care plans that are genuinely individualized based on what the AI identifies as the key factors for that person.
You can see how that avoids years of maybe struggle or misdiagnosis.
It could significantly improve well-being, life outcomes. It's a powerful prospect.
But there have to be challenges, right? Putting this kind of AI into actual clinical practice,
Absolutely. And this brings us to the crucial ethical side of things.
like data privacy.
That's a big one, yes. Patient privacy, data security, those are paramount. But also algorithmic bias.
Meaning the AI might not work as well for everyone.
Potentially, yes. We need to ensure it doesn't unfairly impact certain groups. And that explainability we talked about, it's vital for auditing the AI.
So you can check for those biases.
Right, and make sure doctors, patients, family, everyone can actually trust these tools because they understand, at least generally, how they work.
We need to make sure the tech empowers people, doesn't create new barriers.
That's the core challenge, using this power responsibly.
So it really boils down to this combination, doesn't it?
Yeah.
The efficiency and accuracy of AI, but paired with that crucial interpretability.
Yes. That combination is what could truly revolutionize diagnosis, especially for neurodiverse people.
It's an exciting frontier.
It is. And as this technology keeps advancing and it's moving so fast, it really leaves us with a big question to think about.
With that?
How do we make sure that these powerful advancements in mental health care are not just effective and smart, but also consistently ethical, fair, and truly centered around human needs and well-being.